The city is offering a series of free training sessions on prevention of drug overdoses. In response to the opioid crisis, the sessions will take place at firehouses on Thursday nights at 6 p.m. The series was put together by the Mayor's Office of Recovery Services and the Boston Public Health Commission. To tell us about the effort is our guest from the Office of Recovery Services, the Policy Director, Brendan Little. Thank you very much for being with us, Brendan.
Thank you for having me.
First of all, talk about what it is that you're going to be teaching people to do at these sessions.
So these are overdose prevention trainings, and it's a partnership with the Boston Fire Department. We've also partnered with the Boston Police and EMS as part of a broader initiative called the Faith Initiative, and that's fighting addiction in the hub. So at these trainings, what we really wanted to do is expand what we're already doing. So at the Health Commission currently, we hold overdose prevention trainings to expand the public's knowledge about the life-saving drug naloxone, or Narcan as it's commonly known. So it's really just letting people know about that and equipping them with it if they choose to want it. And also just really about the scope of the issue in Boston currently and what it looks like and what does it look like? What are signs and symptoms of an overdose? And these are issues that are difficult for people to talk about sometimes, and we think that our partnership with the fire department is really beneficial because they're in the neighborhood, so they're neighborhood-based conversations, which is helpful. And somebody might be more willing to go to a firehouse, and because firefighters are popular, and it would be a great. We figured it would be a really good partnership to sort of let them host that and show that they care about it, because all of our public safety partners have shown tremendous care and tremendous solidarity in this opioid epidemic we're currently facing. So this was their willingness to really host it and allow us to do what we do so well, which is we have a great team of overdose prevention trainers in the Health Commission. So it's really just an opportunity to expand what we're already doing, and it's really just to expose people to how to save lives and what to look for if somebody's struggling of an overdose.
We're talking with Brendan Little from the Mayor's Office of Recovery Services. Brendan, what's the most important reason to learn how to do this? Is it because many people are reluctant to call first responders when there's an overdose, or is it just because you have to do it right away?
I think that it's a daunting thing, and one of the things that you'll learn if you come to the training is really that administering Narcan is one step. The first step is really to call 911, because if somebody needs Narcan, they've stopped breathing. So that really is the first step. You don't immediately know why somebody's not breathing. So what we advise people is the first step to call 911 and then administer it. And sometimes people are a little nervous, it's a little shaky, you have to put together a kit. But I think these conversations will work to chip away at some of the stigma, and we're hoping that a lot more people will just carry it in their bag. I carry it in my bag when I walk around the city, just in case I see somebody. So we think that over time, the stigma is being chipped away at, and that these trainings will continue to do that.
You mentioned talking to people at these sessions about the extent of the problem. We've seen lots of headlines about that, but what can you say about Boston, at least?
We could say that Boston, like the rest of the country, is facing an opioid epidemic. And it's really complex now with the introduction of fentanyl, which is a really potent opioid that is being mixed in with street heroin. People who usually think they could take a certain amount might be taking 10 times that, because there might be fentanyl mixed in. So there's just really a lot of complex issues facing our community that are struggling with addiction. And really just to let people know what that is, and let people know that if they have family members or loved ones that are struggling with it, there's resources for them as well. So we're really just trying to get at the stigma and show people that are struggling with this that they're not alone.
Anything you can say about how many lives you think this might have saved, at least locally?
Well, we do know that there's been a 28% increase in Narcan given by paramedics this year from last year.
In the city of Boston?
In the city of Boston, yes. So there's been over 2,000 in the last 10 years, and definitely hundreds this year.
Well, you had a session just recently, the first one. What was that like?
It was great. So we had our first session in South Boston, and the fire commissioner was there, Joseph Finn. Jen Tracy, who's the director of my office, the Office of Recovery Services. We had EMS, Jim Hooley was there, and representation from the Boston Police new opioid overdose unit that follows up on overdoses. So it was really just a great partnership. We had people come, they asked questions. Amy, who's one of our great trainers, did a great training to show how to administer Narcan and explain signs and symptoms. So it was really a great success. People heard about it from all different places, social media, word of mouth. So this is just the first one that we're doing. We're hoping to, so we are expanding them every Thursday this summer, and then hopefully into the fall as well.
We're talking with Brendan Little from the Mayor's Office of Recovery Services. Brendan, it wasn't so long ago we didn't have this office. Talk about how this is a departure.
So the Mayor's Office of Recovery Services is the first municipal recovery office in the country. And it's really just a pledge of Mayor Walsh when he first came into office. He really wanted an entity that could build bridges across city departments and across state and community partners to expand work and really just hone in on this issue. So there's been an addictions bureau within the Health Commission for a very long time, and they do phenomenal work, and we currently work with them closely. It's called the Recovery Services Bureau. So what we say is they're really out there doing the direct, God's work, as I like to call it, and our job is to really connect the dots so that they can better do their job. So we're facilitating those relationships with the police, fire, EMS, as well as with arts and fitness and sort of alternative means to make their lives easier and make people's who are struggling with recovery make their lives easier.
Well, I imagine that even beyond any life-saving crisis here, there are people who are, they're struggling. Sometimes they're just trying to help family members overcome addiction, and they need advice about, what's the next step? Can we get into the program that fits this situation? Can your office help them with that?
Yes, absolutely. So at 774 Albany Street, which is the PATHS program under the Recovery Services Bureau, that is a program you can walk in at any stage and you just need help. You could be a family member, you could be somebody who's needs to get a detox bed. You walk in, they'll help you walk through the whole process. And currently you can call 311, the city's hotline, the mayor's hotline, and they can connect you to PATHS for support.
Well, if people want to get information about the upcoming training sessions, which are going to be on Thursday nights at 6, you have a place that might be good for checking that out?
Yes, so the Office of Recovery Services Facebook page, which is facebook.com/ORS Boston, is one place. Also at ORS Boston on Twitter. And we're going to get it on the Public Health Commission website as well. Boston
Public Health Commission, of course. Thank you very much for being with us.
Thank you so much.
Brendan Little from the Mayor's Office of Recovery Services. We'll have more news in just a moment.